on this here, and there have been a lot of conversations in my conversations that I've had as well. There is a comment by Cheryl that keep in mind that many of us already have requirements for several CE hours. Cheryl, I will say real quickly that the intent of implementation of this here is not to add to the number of CEs, but to ensure that the requirements for health equity CEs is a part of the requirements of the CEs already in place. I have not heard of anyone or any profession that wants to increase the total number of CEs at this particular time. However, I have not been in all the meetings that Ashley and Ross have been a part of, but that's what I understood, that the CE for this would be part of what is already established in law and rule for the professions. Going back to you, Deborah, I think it was Deborah. Yeah, Deborah. The purpose of this rules hearing, this rules workshop, is to take recommendations from everyone to be into consideration. And once we move forward, all comments will be taken into account. So your thoughts and ideas is just as valid as anyone else's thoughts and ideas on what this should look like. So what you're sharing is valuable. And I see that Ross have already made comments based on your recommendations.
Yes, thank you, James. And just from the kind of the rules team perspective on this, part of the reason that we included 2 hours here was trying to balance across the different secretary professions, the number of continuing education hours, how they differed between professions and reporting cycle, whether it be some professions need their CE hours completed every year or every 2 years or every 3 years. And there was quite a variance in the amount of total hours required and the period when they were required. And 2 hours seemed to be a reasonable number given the number of hours that some professions have. I believe at least one profession has only 8 hours of continuing education required every year. And so I think that was part of the consideration, but we're certainly open to listening to more feedback about why it should be higher, and we'll certainly consider that. And I know Gail had a question, and I believe that was probably going back to the purpose section. So I can take us back up to the purpose section and we can work our way down. If that is okay. Gail, I saw your hand was up and your questions.
Yeah, thanks, Ross. I kind of gave up. I also have a favor. I know the chat's really important, and maybe it's just because I'm a linear person, but it would be really helpful kind of to go in the order of the rules. That's just a process favor. My question was, James made a comment that these rules are to be can be a foundation. To me, the word foundation can be different than the word floor. So, because a floor is a requirement. So Ross, I appreciate the comments you made that the Department of Health is continuing to think about this, and I don't need to say anything more about it. So thanks.
Yes, thank you, Gail. And I believe our plan after this will be to release another draft, and we'll work to ensure that there's consistency between the purpose section and section 720, and work to make that in our understanding of the intent of 5229 clear. So hopefully that addresses your and the other commenters' concerns.
Yeah, thank you, Ross.
Hey, Ross, sorry to interrupt. Can you make Ashley and I co-hosts, please?
Jeez. Okay, I will try.
All you got to do is hover over our name, and then on the right-hand side of our name, there should be a thing that says more options. There you go. Thank you. I appreciate you.
Okay, Dan, you should be a co-host. If you can make Ashley a co-host too, that'd be great.
No, apologies. I had my lights flicker and then my internet went completely out for a while.
No problem, Ashley. I had the same issue, and I'm sure everyone is dealing with the weather today. I'm not sure how much you caught, but we started off in the purpose section and took a few comments regarding the need for clarity between the purpose section and section 720 about what minimum standards means, whether these rules will be the minimum standards for all professions, or whether boards and commission professions will be setting their own minimum standards and rule, or have the ability to at least. So that's something that I said we'd be addressing, internally, making sure our understanding and intent is clear in a subsequent rule draft. So that was one issue. And we also discussed the number of continuing education hours required every 4-year cycle. There was some concern that 2 hours is not sufficient. So that's basically what we've covered so far. So you can feel free to take over if you'd like, Ashley.
I guess just to catch up then, we finished the purpose section then?
Yeah, we haven't received any more comments on the purpose section other than the minimum standards concern.
Okay, perfect. So I saw a comment or two that says to go in order. So I guess we can go with the next section then, and then we can address some of the other, what is the purpose of this rule that we're working on? Are we setting those minimum standards or whatnot? We can wait for some feedback as well, and whatnot. So let's see. So we worked a little bit on some of the definitions and really drawing a distinction of, the difference between perhaps board and commissions and kind of their role with these rules. And so I received some feedback that there was some different language we could craft here that really maybe delineates the difference between a board profession and secretary profession. And so is there any comments surrounding that? And then do we want to have further discussion related to that? Let's see. Yeah, go ahead, your hand's raised.
Yeah, hey, Ashley, thank you. When I looked at these definitions, and by the way, thanks for calling them out for board and commission profession and secretary profession, it didn't seem logical to me to say a board and commission profession means a healthcare professional. So the language that I suggested and submitted to you all, that a board and commission profession means a profession or means those professions regulated by a department, board, and commission with a continuing education requirement. And so a similar comment in terms of the secretary profession, that it means those professions regulated by the secretary. So I think that would just be more clear, and I appreciate you wanting to call out those definitions. So thank you for doing that.
Thank you for the feedback. And was there any more concern about maybe the definition of a healthcare professional?
Not by me. I thought you did a really good job. You made changes to that in the previous draft. So I appreciated what you did. So thank you very much.
Thank you. Any other comments regarding boards and commission profession or secretary profession? Are we leaving anyone out with our definitions that you notice? Okay. Well, is there any definitions maybe that we're missing in general? Emily, go ahead.
Hey, Ashley, can you hear me?
Yes, I can.
Okay, great. I just have more of a process question. I know that a lot of healthcare associations have submitted comments, and I didn't know, is it possible, is there a chart maybe of all those compiled comments and maybe just kind of taking them one by one, and of course doing them in order of the rule? I think, that's helpful for us all to track, but I just know that there's probably some difference, but also a lot of the same comments. So if we're able to kind of go through those to ensure that all comments are addressed, just want to see if that's a possibility for today's meeting. Thanks.
Okay. I know that Ross has been pretty good about integrating some of the comments in the chat. I don't know, Ross, do you have any more feedback on this? Is it something perhaps that we need to pivot real quick and just kind of have comments available on the side, or?
If I'm understanding the request correctly, it would be to have the comments that we've received, any written comments we've received, to go over those all together with the group. Is that the request?
Correct.
It would take a little work to make sure that we dig up all of the written comments and then are able to go through them now. We could do it, but there may be a little delay, I would imagine. So I guess my recommendation would be to go through with any comments that anyone has now, and then if we finish that, then we can pull up one of the written letters and then go through those comments. How does that sound, Ashley?
Yeah, we can, that sounds great. And then what I can do in the meantime, Emily, is I can share about, I won't say who maybe submitted them, but I can share a lot about what those comments were in that area. And then also the same for, some of the internal comments as we went through. I know with this draft we sent you in particular, it's actually very short, but with all the track changes and all the comments on it, we were pushing about 9 pages and it was very hard to read. So the readability wasn't there, but we can talk a little bit about the comments. And so the comments that I received, just going back where we were, really focused on reworking that purpose section, which it sounds like Ross may have went through and submitted some comments for, and really they stemmed around that wording and really making it clear. And then another question that we really received was, what is the interpretation of this? Are we setting these minimum standards for everyone? Or is it really for the Secretary of Professions, then they adopt, and then the boards can kind of do whatever they want to? And so I'm not sure if I'm missing anything. Can a link of the public comments be submitted to be made to available to attendees? Sorry about that. And Lori, to be honest with you, I am going to have to probably ask how you would do that, and B, if we could do that. But the process is, when I release a draft, there's been certain people who will provide comments on that draft in preparation for the workshop. And so they'll say, hey, here's all my comments. Here it is on the memo. This is what we're going to share about. And they're writing it, but they're also here in this workshop speaking on it. So you'll hear them explain a lot what those comments are. So what I'll do is go back and see how that works. Without a public records request, I don't necessarily know how. And so I apologize for not having that information, but I will find it for you. Let's see if and things are just turning on. So if you see me looking left and right real quick, that's why. And then to go back to, someone asked, what is the active retired? And so what you're really saying is this individual is not participating in whatever profession it is full time, but instead what they are is it's at a retired level, or they're saying, hey, I'm doing less amount of patient contacts. Ross, did I explain that correctly?
My knowledge, yes. I'm certainly not an expert, but yeah, I believe it's an individual who's retired from like active practice, but still wants to maintain their credential. So but still need to complete continuing education requirements.
Right. Was there any more questions on this? Emily, do you have any more for the group?
No, in terms, I mean, I think you answered that. I appreciate it. I just know, when we're working with on other rulemaking, it helps when you have all the comments in front of you. So you're able to go through, and it helps you see, okay, there's 5 different organizations that have a similar concern. It gives you an idea of kind of where the real pain points are, and then also ensures that everyone, who submitted that people are aware of that. And if they were unable to participate today, that their comments are relayed to the wider group. But I also understand the difficulty in doing that. So, we're participating, we had submitted written comment, and we'll of course, chime in when we get to those relevant sections. But I think, yeah, I see the challenges, but I do think it is easier, if possible, moving forward, just to have all those comments in one space so that everyone kind of knows the concerns being raised by other groups. So appreciate it.
And I appreciate that feedback. And so that's something I can roll in the future. We received a total of 4 comments. One of them was around noon today, and then we got one on Friday around noon, and then one on Thursday related to the draft. And then the medical commission also submitted their comments, even though they know they'll engage in their own rulemaking. So those are the 4 comments regarding this rulemaking that I received over the course of the month. And they all, the medical commission said all the changes that were in their draft had been addressed. And then the other 3 comments really honed in on the purpose statement and the definition of the board and commission profession and that secretary profession, really. I see hand up. Go ahead. And you're muted, Galaxy A12. And you are still muted, at least for me.
My name is Dorcas. And I work alone for Eugene Berry. And the other day I started becoming sick, and I'm all alone. How and when do we go for another caregiver to help me? And he is at 24 hours, but I'm only allowed to work for 8 hours. Most of the times I overwork, and I work throughout, and he's in the house with me. So I work throughout night and day without even having an off. But the only hours I put is only 8 hours. To such a cases, before even they employ another caregiver second, what do I do?
So if I heard you correctly, we were looking for some advice. Is that correct?
Yeah.
So unfortunately, I'm unable to give you any advice. But Dan, would you be able to either connect her with the correct program manager or maybe give her some information in resolving that?
You bet.
Yes,
Thank you.
about the hours that I am given only 8 hours and it is 24 hours non-stop all the time.
You bet. You bet. Let me see if I could track down the information and then I will email or I will message you.
Thank you.
Mhm.
Thank you.
Thank you.
All right. So we'll go through and we will provide you with that information. Let's go ahead and move down, Ross. All right. So right here, you have some comments. Do you have a background for this, Ross?
Yes, this is what I believe Gail had said. The initial comment was related to the purpose section, and it was just aligning 720 subsection 1 with the purpose section, where it currently, subsection 1, says that boards and commissions can set their own minimum standards for health equity continuing education. And it doesn't seem to be consistent with the purpose section, which alludes to these health equity rules being the minimum standards for all health professions. So just on our end, we need to be clear in these rule sections whether these rules will be the minimum standards for all professions or whether boards and commissions will have the ability to set their own minimum standards.
Okay, thank you. That actually helps a lot. And so that was one of the questions that we've been kind of that we received on Friday, where there's some level of inconsistency. And so what we'll do is we'll address those in the next draft, and then we'll be able to submit those via GovDelivery. And then any comments that you have, just go ahead and email us and you'll get a response back from me saying that I received it and kind of what we're going to do with that comment. And then hopefully we can kind of dial those down between today and then the draft. So I guess I want to go over to what seems like the big conversation is this 2 hours. And it seems that you have some concerns that 2 hours is insufficient. But then also in the comment, we are hearing from other programs saying that anything beyond 2 hours might actually be a barrier. And so I kind of want to open it up a little bit more for that dialogue. It appears that it may not be finished. So I said I did some work before I got cut off with the power going out and the internet. And a lot of that work was just kind of getting curious and asking different programs, hey, is it reasonable, feasible for you to open up your roles to define these hours separately in each of your roles? And then another question I asked is, does 2 hours present any concern or barriers? And of course, my wording was a little different than that, and I can pick up the exact wording. But the feedback was that a lot of the boards and commissions are going to further do work surrounding health equity and continuing education and the amount of hours. But as a minimum, so as a base, they thought 2 hours was a good starting point. Now, I've heard from other programs as well that have different continuing education requirements that 2 hours might fit and not propose a barrier. But last week, or last workshop, we heard 6 to 8 hours and 2 to 4 hours. And so I really want to concentrate maybe on this section, and let's have a conversation about that, the hours. So does anyone want to share first? Okay. Does
Well,
everyone like 2 hours?
This is Deborah.
Oh,
This is Deborah again. I already commented, so I was trying to hold back and let others have the opportunity. But somebody who we've tried to do a lot of workforce training at our organization, Seattle Children's. If we're really serious about this is in my opinion, and I think other opinions as well that have far more expertise than I do, a really complex concept and difficult to understand. And I feel like 2 hours every 4 years is just, I don't see how you can really get a deep understanding and appreciation for this. So again, 2 hours just seems so insufficient. And if it's only every 4 years, I guess I would challenge us, gosh, couldn't we just do a little bit more? And I think to your point, the different licensing bodies are probably going to increase it if they think it's appropriate, but it doesn't feel like enough. And maybe we need to understand more about what would be included in the content and work backwards that way. I just don't see how we would do it.
Yeah, and there's some really, really great feedback. And I would like to, what would you maybe, I know you don't have a lot of information, but based on what you saw, what would you recommend for a minimum amount of hours?
I could live with a minimum of 4. I think you could get into some definitions, maybe some understanding of the evidence so that people understand that health equity is a real thing. I think we still have a lot of people who don't think it's an issue. So I think there needs to be some foundation building to help people understand the data, and then help, identify what individuals can do as professionals in their own practice.
Thank you, that helps. Christine, you have your hand up. Go ahead.
Thank you. I'm a psychiatric nurse practitioner, and I'm thinking that there's also a difference in terms of the educational foundation that people have received even as part of their basic training. And I know that's hard to kind of capture and judge and then be able to create kind of a moving target of expectations for people, depending on their graduation year or the practice setting that they're in. But I would agree that with Deborah, with the complexity of the issue, especially the things, right? If we were talking about just gender related things, just race related things, but I mean, for the broadness of the topic, any one of those things you could easily spend 2 hours on, and then to try to actually have a curriculum that meaningfully is on all of those things, it just feels like 2 hours is an impossible thing. At the same time, I hear, from the last session, the discussion of, talking about somebody who's like a volunteer firefighter in a rural area. I can appreciate that that person really realistically should be held to a different standard than somebody who's, working 60 hours a week in a hospital setting. So it just feels like I don't envy your challenge of trying to identify specifically what it is that seems reasonable. But I think if 2 hours was what ends up being arrived at, that there really be an emphasis on that being a minimum standard, or there being some kind of way of even kind of delineating the breadth of these rules and what might be considered applicable, by at least maybe providing a recommendation then that the training be, this number of hours if you're working in, this type of a role, or this many hours, if that's something that would potentially be feasible.
Okay, so what I hear is perhaps a tiered like hours section. Which one of our workshops that was actually brought up in a lot of ways. How are we equitable with our health equity rules? And so do we look at maybe 10%? I think was what was thrown out there last time. 10% of whatever's required currently or expected, and how do we do that? Lori put in, not all not all professions are incorporated into a large health system that can afford to put together a 4 to 6 hour training. Let's see. Someone said quality is important, is as important as quantity. Susan, your hand's up.
Hi, I'm Susan from the Chiropractic Quality Assurance Commission. And I agree with the two previous speakers in terms of the importance of this subject of this bill and how we get the message across to everyone. And I'm thinking in simplistic terms that, yeah, 2 hours every 4 years is really, it's difficult to even conceive of whether that would be useful. But if we cut it down to a shorter period of time or a shorter number of CEs that are needing to be acquired on a yearly basis and start out with just the basic tenets of it, like bias training. The first year that you're going to get a CE in this topic is going to be on bias. And bias covers all of the areas, really, because you can look at each of those areas in that training and say, look at this, and then in some way figure out how to market, like giving your patients something to fill out, to complete, to see if they have, if that practitioner has reached understanding. So is that clear? Am I making myself clear about that? I think it's.
Yeah, that's definitely clear. So I would ask.
In terms of time, but to start at the basis.
So maybe you broke out for me. What was that last part you said?
Yeah, I did. I'm having electronic, I mean, we don't have any power here, so I'm on my phone and it rang. But what I think is that we need to start simplistically and at the basis, and bias seems to be the basis for it, and understanding and identifying that. So in short, just, you don't make it every 4 years that you have to get this training, make it every year that you have to get this training, but don't make it that you have to spend 2 hours, make it that you have to spend a half an hour. And then that half hour can be focused on bias. And the next year, the next topic would be the next topic that's identified through this forum. Does that make sense?
Okay, so let me see if I got this correctly. So now it's content-based, and yours is building up on those topics each year instead of really focusing on the hours per se.
Yeah, cut it down so it's not unachievable to obtain those CEs, and make it more frequent so that it's fresh and that everybody's building on this whole thing, because it's a huge topic and it's not going to be done in a matter of years, really.
Thank you so much for that comment. And it really gets to another question I have for everyone. How do we also make this training where it doesn't look like a burden when a professional reads it, but something that's really doable and gives the flexibility as well for them to pick something that really speaks to them? So do we have any other ideas on that, and how do we incorporate maybe this continuing education hours if we were to keep it? Lenise, your hand is raised.
Hi, Lenise Taylor. I'm at Maple Valley. I work with our national nursing organization for oncology, and we put together conferences and focus on the continuing education. And one of the things that we are working on this year, because our conference is in California, is following the letter of the law for California, where they're requiring that any session, any continuing education include content on implicit bias. And so then we took it the next step and looked at the Future of Nursing report and started to incorporate things around social determinants of health and asking our speakers to do so. So going back to your comment about how this becomes not burdensome, but becomes something that is part of the professional growth, for want of a better word, is how we've incorporated it in our sessions has been less around the content, it's requiring specific content, but requiring that sessions that are being provided include content related to the social determinants of health or related to implicit bias. And so then it becomes incorporating into a session where it becomes meaningful, as opposed to having a standalone piece of things. And so an example on this is our cancer medications are incredibly expensive. And so there's a lot of financial toxicity that goes along with that. And then if you deal with, and then if you have people who don't have access to the funds for this, then you're going to have a different level of response to those medications because they can't even afford to buy them. And so that's something that we then can go back to our nurses and say, okay, this is something that when you're talking to your patient, you don't just ask if they've got the medication, but do they have the funds to obtain that medication and still pay for their telephone and their apartment and that sort of thing. So I feel like it's going to be more meaningful if it can be something that can be incorporated into the work that the healthcare professional is doing.
So not time-based, but well, I wouldn't even say skill, but okay, that makes sense. Some good ideas. Now I want to throw in another caveat or something else to consider too. And this might go with what Lenise and Susan shared. When looking at programs, and so there's a requirement, right, that we have to identify a free training program, right? And so I've been looking at different programs, both mainly in Washington State, but also abroad, in person, conferences and online CEs. And it seems like the average is about 2 to 3 hours. So how would we maybe adjust, other than a conference, but how do we also make sure we don't box ourselves out of these opportunities by putting too much limits on the rules, including hours? And then Cody says, Clarity is tasked with who needs to develop. In the meantime, Ross, will you make sure we capture that comment? Someone says, you set a minimum amount of hours. So that's actually what we've done here, right? Is we set a minimum. There's nothing that's preventing someone from going over. But what about the professional? And I'll admit, this is me. You know, I realize my birthday is in less than a month and I still have some continuing education that I need to complete, right? What about the professional that maybe backloads all their continuing education before the next reporting period? Someone says, I like how NADAC does their CEU trainings. Gil.
Ashley, I'm not sure I understood your question. Are you, because there's no prohibition about a healthcare professional taking more than 2 hours, right? So if somebody arrived and say you need to get 15 more credits, you could seek out and 15 credits in health equity, right? Is that what you were asking?
Yes, and I should expand a little bit more on that. A lot of the conversation that we had surrounding not even defining the hours or keeping them too low, right? Is that as a health professional who's under a time crunch, I might find what meets the minimum requirement, right? And so if I see something that maybe it's context based and not hour based, are professionals receiving the right training, or maybe enough of it? Whereas we can say that it's not, you can go above and beyond the hours, but at least setting that minimum hour, right, ensures that at least the professional spends a certain amount of time in that topic. Is that something that perhaps we've also taken into consideration when putting these hours on?
Thanks for that information.
Well, I saw the time. So why don't we mull on that a little bit and let's go out for a break. We'll all come back at 2:15 p.m. So 11-minute break. Check on your yards, make sure everything's great, and I will see you here. Okay, it is 2:15. So we'll go ahead and pick back up. And so real quick, in the chat, someone asked, can't the state provide a minimum requirement of 2 hours? Then boards and commissions set a higher requirement if that's determined. And that is 100% correct. So boards and commissions still have the ability to set higher minimum hours. Now, the secretary also has the authority to set that minimum standard for all secretary professions as well. And so when we look at these model rules, these minimum standards, they'll cover all secretary professions unless they engage in further rulemaking to increase the standards that are already, the minimum standards that are already in this rule. And then someone else asked, oh, same name. Can you create a list of examples on the topics of training one must take for the CE? And so we'll actually get to that a little bit once we close up talking about the hours. And based on the time and the feedback, I just want to ask this group, what are your thoughts about holding another workshop? In 2 weeks. Given there are so many questions, you support it, all right? Yes. Anyone like, no, you're wasting my time? I don't think, or no, I don't think we need one. You would like an opportunity. We definitely will send out an a updated draft. So I can guarantee that. But I am open to doing another workshop. I actually held one on the calendar just in case. It seems like there's a lot of comments and some more further exploration is needed. Okay, perfect. Cool. So I can try to get our draft out sooner. No promises. And then someone said it would be helpful for a chart. So I will try to provide the stakeholder comments. Another thing that we have is people can submit comments and questions at any time. And so we prepare for this meeting in advance. So I can send what I have, but that doesn't mean I'll necessarily have everything, if that makes sense. If there's any new comments. Giving a deadline. Yeah. So is Ross back or did we lose him again? I feel like deja vu. I might end up disappearing now. Okay. And Katie, go ahead.
Ashley, thank you very much. You know, for the group, my name is Katie Holstein. I'm the EMS, the Emergency Medical Services Manager for the Department of Health, representing certified EMS providers and ambulance services. And I just want to go back to the 2-hour comment, the 2-hour requirement really quick, because I'm really trying to advocate for the providers who are going to have the most difficult time complying with CME requirements. You know, maintaining access to EMS services in rural communities is of great concern to us in our office. Most rural EMS services are dependent on volunteers, and we have seen a rapid decline in the number of volunteer EMS providers in the last several years. especially this last fall, we saw a significant decline. Several EMS services in rural communities have transitioned from being transport capable to first response only, meaning that the community members in those communities have to wait longer for an ambulance to come transport them to the hospital because of their loss of volunteers, which in itself is a access to care issue. The minimum hour requirement should be achievable to the professionals that would have the most difficult time meeting the requirement. It's a minimum standard. That means that we can exceed the standard in other areas. We can look for other ways to advocate for more education, for medical program directors to who now, when they provide education to EMS, do integrate health equity information and that lends into their education, because we know the conversation has been started and there is good work doing that. But this would be a difficult thing for volunteers to comply with. Additionally, an education topic this complex, in my opinion, should be delivered in a manner that's more easily digested and in smaller doses for this particular audience, for the EMS providers. I think we'll see more success if we have people engaged in the education that have smaller doses over a longer period of time and time to integrate that education and internalize it into their person, have opportunities to go out and practice this versus, forcing them to do something that, they just work their 60-hour week in a community far away from home. Now they're volunteering as an EMS provider and have to do 150 hours of education every 3 years. This is more education for them. I just don't see that our rural EMS providers are going to be able to achieve more. Every year we're asked to add more hours of education to our EMS providers. During COVID, our providers, expanded their scope of practice to administer vaccine, to administer COVID testing. They absorbed significant number of hours training to do that. And now we're turning around and saying, well, this topic is also important, which it is, and we support it. But I just don't think that our rural volunteers this is not going to be palatable to them. So I'm just strongly advocating for a minimum standard of 2 hours. Over time, perhaps we can exceed that and find other ways to address it. But for the EMS audience, I just don't know that it's going to be palatable if it exceeds that. Thank you for allowing me to make the comment, Ashley.
Thank you for sharing. Do we have any questions or thoughts with what was just shared? And while you're formulating that, I do have a question, Katie. What are they considered? Are they credentialed, registered, licensed?
The EMS providers are certified and they're a secretary profession. So they have to take initial training. They apply for a certification, which is a license to practice under a licensed provider. So it's certification in Washington is a type of license. They're not independent practitioners. They do have to work under a physician. And their certification period is 3 years. So every 3 years they have to renew. And to renew, they have to take CME, continuing education hours. Currently, EMS has the highest burden of continuing education hours than any other profession that DOH regulates.
Okay, thank you for sharing that. In the chat, we have a comment here. It sounds like we need different standards for volunteers and people working full-time. Someone says if the employer offers this training, will this be accepted as a CEU? I agree with Katie. This statute doesn't provide that type of flexibility. Bottom line, they are credentialed. As a result, the training is required. And then someone says that definitely sounds burdensome for volunteers. So you know what? Let's move on. And so someone brought up in the chat, some goals for that next meeting. And I want to go ahead and mull around and put in some additional comments and make some of the adjustments to the previous language. But for the next workshop, I would really like to concentrate on 2 sections. And it's this continuing education number, right? And then the next one would be kind of what do those topics look like? And so we'll hit on the topics a little bit, and maybe that will kind of drive some of the thought process surrounding this amount of Cs. Go ahead, Gail.
I think you need to add the purpose section, because that's kind of a continuing theme. I know of Jeb and myself and others. We need to know, what are the parameters here? Are these the minimum standards for all the professions? Are these the minimum standards for the secretary professions? And the board and commission can decide to adopt them or to adopt different ones. So to me, that's core, and I'm going to be looking for that in the next draft to have, to sort that out. So I wanted to add it.
And perfect. And I do agree. So we'll work on that. They'll be rewritten, kind of reworked purpose section. We'll develop those definitions that there were comments on, and then we can focus on, does that purpose speak to the amount of hours, and then do those amount of hours really, are they reflective of the topics? And then we can keep it kind of to those areas, because it seems like those are where most of the conversations happen. And based on Gail's comments and the agreeances in the chat, it seems like that holds a lot of weight maybe to these further on conversations. Did I capture that right?
For me, yeah, this is Gail. Thank you for including that. And I see some folks agreeing in the chat as well, so thank you.
And so, great comment. Topics will change over time and years. And so, Ross, why don't you kind of move down a little bit? And let's talk about this training content, actually. And so what I did was I listened to a lot of the feedback, and it seemed like this idea of really broad topics, and then they can go narrower as the professional decides, or the board and commission dictates. They could feed in a little smaller. And there was some conversations about, well, we like the topics categories that UW created, right? And so what I did was I got rid of all that was written before, and I really pared it down to 5 topics. Now, I was able to find multiple training programs that met these topics. And in fact, they were actually, one training program might address 1 topic, 2 topics, 3 topics. And the longer programs addressed all the topics. And a lot of the feedback that I received from program managers was that these were topics that they could actually integrate into their profession. Even veterinarians said, hey, these could probably fit. And so I just wanted to pause here and first talk about the topics themselves. And was there any comments? Was there any feedback, anything related to those topics themselves? The written feedback that we received did not actually talk about the topics themselves. Yeah, someone said being too specific would be very difficult to monitor. Gail, go ahead.
Yeah, I just, in my comments, I probably should have been more positive. I thought you did a good job in reconstructing this training content. I thought there was a lot of flexibility in that it could include at least one of the topics. You also referenced back to the statute, which I thought was important. And you removed what seemed like overburdensome requirements on the qualifications of the trainers. So I really like how you kind of re-envision this. So thank you.
Thank you, Gail. Any other thoughts on these topics? Because the second part of this then would be training must include at least one of the following topics. And now we did receive some feedback from program managers. Why just one? Why not 2, 3? And so I just kind of wanted to give open space to discuss, are we okay with just saying one topic in these general 5 areas? And then saying trainings could include, but they're not limited to also the list that was already pretty well done up on different types of topics. Dawn, your hand is up.
Hi, Ashley. Thank you. So Dawn with EMS Education Training. I also like what you've done with your topics. I think they're broad and they're flexible, and it would allow us an opportunity for our rural providers to take things in digestible pieces. I can see, incorporating more than one, but having at least one, I think, is a good approach. Thank you.
So we do have a comment that says, hey, they're all important, just as important as the others. So we should include all. So what can we foresee some of the benefits of increasing that number from 1 and some of the downfall? So it says inclusion. Someone said ageism needs to be included. And so when we talk about, for example, ageism, right? Could it actually be included in one of the broader topics? And that's a real question. I think we'll find that rarely it will only be one topic, or it will rarely only be one topic. It seems like a balance of breadth and depth. Increases the breadth, decreases the depth. Someone said, keep in mind it can be repeated, or the CE has to be repeated every 4 years. Should you include language allowing repeating topics? Okay. Each provider can be given some leeway. Ross, you had some pretty good insight that you shared about continuing education. Would it fit here, and what a provider is able to do in terms of, can they take the same training program or same topic every 4 years?
Well, I don't, there's a lot of program managers here that can correct me if I'm wrong, but my understanding is generally you're not allowed to take the same course twice, or at least within the same reporting period. But I think certainly taking topics under these broad, or taking a course that fits under these same broad topics, or multiple courses under these same broad topics, is acceptable. But again, I know there's a lot of folks here with a lot more knowledge than myself that could probably address that as well, or correct me if I'm getting that wrong.
Is there other program managers that are available and want to speak up on this? Someone says, I don't see ageism captured in this list. Okay. And then, can the CE be repeated per licensing renewal? it's going to be difficult tracking on 2 different cycles, every 3 years for RNs license, and now every 4 years for this. Now, you know what? I do kind of want to talk about that cycle a little bit. And Ross, maybe at this point you can correct me. But there has been quite a few comments about the cycle. And my understanding is that cycle, when it says every 4 years, it means every 4 years. We can't actually change that cycle, can we?
No, the requirement for every 4 years is in law. That was part of 5229. So I don't believe that we'd be able to change that through our rulemaking.
Yeah. So maybe you can answer the last question, Ross, and I'll be a little quiet. I know you did a project with the continuing education in every profession.
Let's see here. Is this the question asking how many professions require CE reporting every year? We could, off the top of my head, I don't have the answer to that, but we could take a look and see how many professions require every year, 2 years, or 3 years, and provide that information if it would be helpful. And maybe we could just include that at the next workshop, like Ashley mentioned, if that would be helpful.
Would that be helpful for everyone? No quite word.
Well, Ashley, this is Katie, just to help, provide some conversation. I think the more specific that you get in this rule, the more difficult it will be for all professions, to be able to use it or point to it. The more specific you get here, the more likely each individual profession will be having to open their own rules to make adjustments to meet this requirement. The more broad it is, the more likely we'd be able to point back to this rule and not have to do our own rulemaking and stakeholdering. In terms of rulemaking, it's a process, and it costs money, and we didn't receive funding for rulemaking for this body of work, and so it would be an additional burden, to do individual rulemaking. So our preference is to point back to this rule, but to do that, the broader it is, the better it is. If at some point our stakeholders come to us and say, no, we really want to be more narrow, then we would, conduct rulemaking to be more narrow. But just in terms of trying to make language that supports as many professions as possible, the more narrow you get, the more difficult that will be.
Yeah, it's definitely the interesting or difficult part of this is how do you maintain that individuality of that professional where really their development is much more meaningful to them while still maintaining that equity perspective, and then also recognizing that these minimum standards, these secretary professions have to adhere to them. And so how do we not box ourselves in a corner? And so, what I'll do, Lori, is kind of one of my assignments is to ask that specific question for legal advice and ensure that that's being interpreted correctly. And we'll have hopefully an answer pretty soon for that. But my understanding is that it was written in the statute very specifically. And so there's really no room to change that. Like I said, I could be wrong. All right, well, we'll move a little further down then, Ross, to number 3, which is the trainers delivering health equity continuing education. And so this was changed to really acknowledge all the wonderful comments that were given. And from the comments that we received, basing something versus how many years you've been providing this training or you have experience, or really based on your education or being a healthcare provider, it was really limiting language and could present a barrier in itself. And so I was able to take with the team what still existed from what we struck out in the first two previous workshops. And really, we saw that there was really two things left. And so we rolled this section, this quality, up into kind of what this training requires. And is there any more comments on this? Is there something maybe that was overlooked, missed, that needs to be added, or are we still too limiting in our interpretation of who can provide trainers or the training? All right, we'll put it as a win. But of course, you can still give us comment about that. Looks like broad and easier to meet. All right. So then the fourth one, which was kind of our last section, was it has to, these courses have to assess the healthcare professional's ability to apply these concepts into practice. Now, a lot of people ask, well, what can DOH do to ensure, professionals are doing certain things, and really review this bill and some of the comments saying, hey, if you can't do it, don't put it in there, really led to the development of this section. Someone says the language is vague, but probably okay. So I don't know. I'll take any thoughts on these sections, and I'll just kind of be quiet for a little bit. And if you have any recommendation on language changes, we'll gladly take that as well. Language seems to be the same as other CE requirements. I think these sections look good. I may have taken that language out of different professions and then had Ross and Hope look them over for me. The consistency is helpful. Trainers should be certified, which can have low standards if necessary. Oh, we're getting something big. One moment. Okay, read that topic. Who would be the certification agency? And where do you see it referenced in there? It would be DOH, but relation to a previous. All right. So not too much there. So I want to ask, is there any section we need to go back to and talk about during today's workshop? Is there a testing requirement? No, I did not see a testing requirement in there. Of course, now I'm going to reread the language again. But not only did I not see a testing requirement, there was actually even no funding to develop the education for this program or really maintain it once this continuing health education was put in place. Am I missing anything, Ross, on that front?
I believe there's, I'm sorry, just let me pull up the language. I believe there's a reference in what's now 4376.13 to I believe it's 3C. It states the courses must assess the licensee's ability to apply health equity concepts into practice. So no testing, but it does state that the courses must assess the licensee's ability to apply health equity concepts into practice. So my understanding was that is what this section was attempting to kind of deliver on.
So someone asked, well, what does it look like when they fail, when they don't pass? Well, I think that program or whoever would be providing that training wouldn't then give that continuing education certificate to that individual, I guess. And this is just me thinking out loud, because really the enforcement comes when we do an audit and then we find that a professional hasn't completed these requirements for continuing education. And Gail, your hand is up, so you probably have a better interpretation than I do.
I don't know that if it's better, but thanks to Ross for pointing out that language. But if someone is taking a course when there is a test, then you would have to successfully pass the test in order to get the credit. But it's A or B, which I think is important. And B is a document provided at the end of the in-person or virtual training that attests the individual was present at the training. And I think that's fairly standard. So, you know, it's imperfect in a way. We're dealing with healthcare professionals and they have to attest that they've taken these classes, and then they have to keep the documentation if they're audited to, you know, that verifies that they have. So.
Great way of explaining that, Gail.
Thanks.
And I think this is the difficulty too, because the intention is, right, professionals are going to come away from this training and they'll make a difference, right? And so now we have, well, what is the duration that someone can get these core, at least basic skills that they can build off of, hopefully. Then also, what providers can we send these people, you know, these professionals to? But then also, how do we ensure that they're actually gaining that base in these topics? And so really, there's going to be a tension between all of this. And then when you add on the set of rules isn't set for one profession, but multiple professions. What was it, over 50, I think? It's just throwing a number out, Ross, but that's a lot of professions. And so what's important is behavioral change, right? Well, hopefully they would change. Hopefully that would be important too. But for some, it might even be awareness that, hey, which you could argue is a behavioral change, but, you know, this isn't set up to be equitable. And then that can spark something new. Okay, how do I go about that? Is this something I need to do? If I'm administrator, do I change the policies and procedures? And so, for example, administrators are included in this as well. So I think what we'll do is we'll do the next workshop, right? And so I will send out a Gov delivery and I'll send out the rules as well. But the time we have, right, is 9 a.m. on Monday, April 18th. It's 2 hours. That time is blocked off and works for the team's calendars. And so what we can do is we'll address the purpose section, really hone in and make sure that that language is actually representative of the whole. Then we can look more at digesting the topics and making sure that these minimum standards are actually doable in terms of the continuing education required. And I'm missing one other thing. We'll integrate comments that we receive that's written, and then we'll try to do a presentation or at least get the information for everyone in regards to what professions require what reporting cycle, etc. And then I will also do some research for you. Jeb.
Yeah, thanks, Ashley. I'd just like to put in a request. So we're looking forward to the next iteration of the rule and the stakeholder workshop. I think, and I hate to sound like a broken record, but it would be really helpful for us to have an understanding of the goals of this work group in terms of if this is a floor or a model, so that we know how to provide useful feedback. So if that's possible to get before we see a next draft, I think that'd be super helpful for us.
Yes, and so with doing the Gov delivery, I'll make sure too that the next workshop is very clear in that delivery message. So I'll probably break away from the typical template and do something that really sets out those goals and the purpose during for that workshop as well.
Thanks, Ashley. That'd be super helpful.
And then I will try my hardest to get that Gov delivery out to you guys sooner than later. And then perhaps I'll have another copy of the drafts with the comments available for our next workshop. If not, the draft that we do bring to this workshop will have the comments on there. And so I can make sure that happens. Any other comments or food for thought? Well, if not, I will go ahead and give you back 7 minutes of your day. And I'll kind of stick around for questions for a little bit, but thank you for joining me. And I will see you in 2 weeks.
Thank you.
Ashley, I'm going to kill the recording if that's cool.